Representative Johnson.
Thank you, Chairwoman. Representative Oliverson, or Dr. Oliverson, is gender dysphoria a true medical diagnosis and term?
I think the concept is certainly something, but it unfortunately has become a, I would say it's become so expansive, so sort of pulled in many directions that I believe it to be an imprecise medical term.
Do you believe that there are physicians in Texas that are practicing gender-affirming care or treating gender dysphoria in a true and accurate way?
No.
You don't think there's one physician in Texas?
I think that the ones that are prescribing hormones and puberty blockers and referring patients for surgery as adolescents are failing to follow the science entirely.
And so referring for surgery as adolescents, you're aware that that's not a standard of care and that there are not surgeries performed in adolescents?
That's actually incorrect, Representative.
Could you give us a citation as you asked for?
I can tell you that when we heard this bill last session in 2021, we received public testimony from a physician, not in this very room, but in where we normally meet, who testified under public testimony that in fact we do mastectomies on girls under the age of 16. But then she added, but that's completely reversible.
Okay.
Of course, we all know that's not reversible. That's foolish to say that that's reversible.
And under your bill, mastectomies or cosmetic procedures would still be allowed for individuals as long as they're not claiming gender dysphoria?
Well, I think you have to distinguish whether or not we're removing normal, healthy anatomy or we're removing abnormal anatomy. And I think the example that gets thrown into the mix, which unfortunately is a mischaracterization, is a male adolescent with gynecomastia, which is an abnormal proliferation of breast tissue in an otherwise healthy boy. That is not a normal developmental condition.
Is cosmetic surgery considered to be removing abnormal tissue?
I'm sorry.
When you said that it's not happening unless it's abnormal, I'm trying to clarify. If somebody is getting...
I'm not aware of a mastectomy being performed or any breast reduction surgery being performed on anyone under the age of 18 for anything other than abnormal anatomy, other than what's happening here.
In this circumstance, though, under your bill, it does not contemplate if somebody under the age of 18 with parental consent wishes to have cosmetic surgery.
Such as?
So let's say you have a young girl that has one breast that is larger than the other and that is causing her discomfort or emotional concern, or she's getting ridiculed in school and says, these do not match and I want them to match. Under your bill, would they still be able to perform that surgery to correct the distinction between the two cup sizes in the two breasts?
Yes, that would be my understanding.
And so in that respect, surgery for that anatomy would still be allowed for a child that is claiming to have mental distress or concerns as long as they're not expressing gender dysphoria.
I think that I think those are light years apart, honestly. I mean...
And the parents in those circumstances are participating in making those decisions, and one would be permitted under this bill, but the other would not, correct?
Right. That's right.
Also, hormone therapy. The hormone treatment that is done can also be done for precocious puberty.
Actually, it's typically not done for precocious puberty. For precocious puberty, usually we prescribe puberty blocking drugs because it is an inappropriate expression of puberty. When you have a child that enters puberty before the appropriate age for puberty, there can be negative consequences to that, just as there would be for suppressing puberty at an appropriate stage where, you know, a child should be undergoing puberty and developing bone mass and continuing to have growth in the brain and the heart and other, you know, bodily systems.
And so in this circumstance, the same puberty blockers that you are indicating could still be prescribed by physicians in Texas.
Those
conditions like you just expressed.
there's a section in the bill, Representative, that specifically outlines a series of exemptions for the treatment of conditions that are medically verifiable genetic disorders, where there's an abnormal development. Puberty is not proceeding normally, or because of a chromosomal abnormality, a child may not ever have a normal expression of their sex assigned at birth.
And again, in those circumstances, so it's not a complaint over the surgical procedure, and it's not a complaint over the hormone because it's prescribed in other circumstances. The ban here is in circumstances where physicians, in working with the families, have determined that it's appropriate for gender dysphoria. That's the ban.
The ban is basically because, has to do with conditions where the science is essentially inconclusive, poor quality at best. We have a growing list of harms that are being done. We have a growing list of people who have gone down this pathway because they were told it was going to solve all their problems, and now they are ruined.
And in that respect of science, and your term being inconclusive at best, as a governing body, would it be more appropriate for us to maybe put together a combination of scientists, doctors, folks that we agree are experts within the field, and have them begin to do a study on the differing testimonies that we may hear today as to whether or not the efficacy is good for Texas public policy or not?
So, Representative, I contemplated that, but the reality is that that's already been done 5 times by countries around the world that have far better ability at gathering record keeping because of their national health services, have much better data to be able to analyze this, and also have had more experience farther along this pathway than we have. So I don't know what value we could possibly add by basically, if 5 out of 5 systematic reviews agree that the evidence for this is lacking and that this is a poor standard of care that is leading to harm and that it doesn't confer any benefits in terms of reducing the risk of suicide or improving gender dysphoria, then I'm not sure what we could possibly add at this point.
If today we had a number of Texas physicians or even Texas medical associations and groups that were to come up to say that they have differing studies or opinions, would that maybe raise the question of whether or not it would be more appropriate for this body to do something like create a study?
Again, I would say that this issue has been looked at exhaustively by the greater scientific community. And so I don't anticipate that doctors in Texas are a microcosm that is completely insulated from the rest of the world.
But it would
this issue is a worldwide issue, right? And so I think that what's really disturbing to me is that a number of groups in America and a number of physicians in America have failed to pay attention to the multiple systematic reviews that have already been done and essentially either do their very best to silence or squelch out any dissenting scientific opinion, which is in and of itself non-scientific, or have completely just ignored the risks and the changing and evolving knowledge that we have on this subject.
And I guess my question from a policy perspective is, there are steps within our process and system by which we could do a study. If it is a slam dunk, as you say, then we may be back here in 2 years with the documentation to say this is the right thing for us to do. But doing a study is possible. I know that's not what you want to do, but I'm just asking, is it a step that this state could take?
I think it is certainly always a step that could be taken, but I don't think that it's a step. I think it's a waste of resources at this point. Again, I would ask you, what could we possibly add to the 5 comprehensive systematic reviews which have already been undertaken? I mean, this is sort of like, yes, you can continue to do a study on gravity over and over again to prove that gravity still exists. You can always do that. But the question is, when 5 out of 5 comprehensive systematic reviews conclude the same thing, what value is there in doing a 6th?
We could also put together part of the medical board put together a review. I know that's hard, maybe because you said there's not one good practicing doctor in Texas on this issue, but presumably we could find medical personnel that are qualified and have them participate in coming up with a plan or a schedule by which would be, if you don't agree with today's current standard of care,
Yeah.
an additional element or safeguards to not have what you claimed is experimenting and preying on fears of parents.
Yeah, and again, Representative, we can do all of those things, right? We could do nothing.
Could do those things.
We could just ignore the systematic reviews that are already out there. But again, my point is this has been done.
Okay.
This has not been done once. This has been done fairly exhaustively. There's nothing for us to add.
Let me also ask
this
about
point.
the uniqueness of intersex. This bill does not ban parents from making a decision early after birth and picking the gender of the child that is intersex. Correct?
Those would be medically verifiable genetic conditions associated, with an abnormality of normal development.
And in that circumstance, the parents often choose the gender, maybe because they were hoping for a girl or they had their grandfather's name picked out. But the parents get to choose the sex of the baby before the baby begins to identify maybe their leanings. Correct?
I think you'd have to talk to somebody that does that for a living. I know that
Under your bill,
I know that there are certain conditions where it is easier for a child to be raised as one gender versus another. Let me give you an example. There's a condition called testicular feminization, where a child is born XY, 46XY, a boy. But because of an abnormality, the body is unable to receive the effects of testosterone being produced by the testicles. And so the body's external characteristics in the womb develop very much as a female. Now, you could make an argument that that child was born a boy and should be raised as a boy, but the reality is that child has genitalia, which is somewhat ambiguous, but probably leans a little bit more female. And their testes, although they're present, have undescended. There is no scrotum. And so it becomes, I think, in the judgment of most medical professionals, or maybe all of them, I don't know, that it is easier for that child to be identified as a girl simply because of the anatomical abnormalities that occurred in the womb and up until leading to birth. So I guess my point to you is that I think it's pretty rare to have a circumstance where it's literally 50-50 on either side, totally ambiguous. Can it happen? Yes. But what I think you'll find is a lot more common is a situation where the patient leans one way or the other. And so then that's an easy conversation.
in the sense that it's.
So in other words, what I'm saying is let's sort of not get, I don't want to get into the weeds of the 1 in a million circumstances here.
Sure.
We have a much bigger population to deal with here.
We do. And in that circumstance where there's intersex and the doctors or the parents pick, it may not correspond with as that individual grows and the gender in which they identify. So you may pick that they should be a girl based on medical science, but they may feel as if they were male. Those children don't get to participate in that process, correct?
I think the more important question to ask here is how do they feel when they're 20, 21, 24?
Okay.
And I'm going to say to you that I think a major problem that we have in this country with the science and the direction that medical organizations have gone in this country, which is not supported elsewhere in the world, by the way, is the fact that there's an overwhelming reliance on the child's internal perception of themselves at a young age when their mind has not fully matured.
Yeah.
And as you know, as a lawyer, we don't let kids sign consents for medical and surgical treatment. We don't let them vote. We don't let them drive. They can't even get tattoos. And so the thing is,
They
is that
can't.
is,
They're not supposed to.
well,
That happens quite a
it's not
bit.
lawful for them
You're
to
right.
do, right? So the thing is, what concerns me is the fact that this conversation seems to completely neglect the fact that an adolescent's perception of self is probably not the best reflection of who they'll be when they're 25. And I think that's what this bill attempts to address. That's why this bill sort of, it says what it says, but it's very silent about what a person can do once they reach the age of majority.
I too appreciate this medical discussion. And I also think you and I both appreciate each other's commitment to faith. And I hope that we can continue an honest discussion about what may be medically appropriate or not appropriate. But I can also say you may not remember the moment you found out you were straight. But I remember the moment I knew I was gay. And it's because society told me there was something wrong about me. If you haven't been a child in an adolescent state that knew, consider from some of us on the dais. Kids know. It's hard. And I hope that this state will find a way to make decisions that is compassionate and is protecting of all Texas children. And I look forward to continuing the dialogue.
Thank you, Representative.